Hello, ladies and gentlemen. Once again, my name is Isaac. Let me talk to you about HIV. I usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Now, in our topic today, I would like us to learn on what happens when you get a HIV virus inside your body. Basically, everyone who gets a HIV virus does not present symptoms immediately. Usually, the virus starts interacting with your immunity, what we call CD4 T lymphocyte cells. They start weakening them and destroying them, and with the weakening of your immunity, this is where the first opportunistic infections begin. The most common symptoms that usually occur to people who are HIV positive and are in stage 1 usually is enlarged lymph nodes, what we call lymphadenopathy. Usually these people may experience swelling of lymph nodes from their neck or cheek or armpits or on their clavicular area. These are some of the symptoms that may arise when you are HIV positive. You have not yet realized it, you have not yet started the ARVs, and it is a sign to tell you, are you aware that it is important for you to get tested for HIV? Number 2, you develop, if you are not tested and initiated on ARV, you will proceed to stage 2. This one, it tells you that your immunity or your CD4 count has started dropping down to now below 1,000 copies or 1,000 cells per milliliter. And these people with 3,000 and or below 3,000, that is on almost below 1,000, even those who are 3,000 may not develop any kind of symptom. They are just as healthy as any other person. But someone who is now below 1,000 cells in 1 milliliter of CD4 T lymphocyte cell may now develop a second stage of HIV symptoms, which includes this person may have some mild diarrhea, which may last even up to 2 weeks, not continuously but intermittently. They develop some diarrhea, they take some antibiotic, this diarrhea does not come off, then they take another one, and it comes in and resolves by itself. Usually it's called a viral diarrhea, and in some cases it may be caused by some protozoa which we call Isospora belli. Now, this person may also develop some skin conditions or dermatological conditions. For example, one that is caused by virus, the most common we call herpes zoster, is usually caused by a virus called herpes simplex virus, and it's very painful and usually follows a nerve root. Usually it forms like a belt of vesicular rashes that are very painful. Other dermatological conditions include fungal dermatitis, which may start either as ringworms or may happen as tinea corporis or tinea versicolor. These are all fungal conditions. Or may develop some nail fungal infections called tinea unguium, such kind of infections. Others may develop some bacterial pruritus or pustules, which may be even as present as impetigo or any other kind of bacterial manifestations on the skin. These are some of the infections that may arise when you are on stage 2. In stage 2, people may also develop some oral thrush or fungal oral infection, or that is oral candidiasis, but not very severe candidiasis, not involving the esophageal system. Now, when you ignore this or your immunity continues dwindling down because maybe of poor feeding and you are not yet started on ARV treatment, you will proceed to stage 3. Now, stage 3 becomes a bit more severe. Now, this person will start having significant weight loss. This person may also be diagnosed with tuberculosis. But this kind of tuberculosis is just pulmonary tuberculosis, not extrapulmonary tuberculosis. May also develop pneumonia and a severe form of pneumonia, which we call PCP or currently PJP or pneumocystis jirovecii pneumonia. This kind of person may also develop a severe form of candidiasis, which we call esophageal candidiasis. This person may also develop enlarged lymphadenopathy, now a severe one, which may also become infected or with a secondary infection. Now, with these kind of symptoms, this person may require hospitalization because ideally this person is seriously sick. Now, if this person is not promptly treated, they automatically proceed to stage 4, which we call it a full-blown HIV infection. In this condition, this involves a HIV or TB infection that has progressed to extrapulmonary, which involves this person may present with TB with pleural effusion or with TB meningitis or any other form of meningitis is also categorized in stage 4, be it bacterial meningitis, be it cryptococcal meningitis, which is a fungal meningitis, be it a protozoal meningitis, which is usually caused by a certain protozoa that is usually obtained from the cats. I'm not remembering the name, but if I remember, I will put it on the comment section. Or it may be cancerous, like the skin cancer, which we call Kaposi sarcoma. It may present as severe as it may be. Now, this person may present with diarrhea of continuous diarrhea of more than 3 weeks. So this person may be presenting with severe dehydration and other severe symptoms, including pneumonia with low oxygen saturations, of which this person may require oxygen supplementation. Now, these are just some of the presentations, including cervical cancer for men and also genital warts, as some of the presentations that these persons who are on stage 4 HIV presentation may have. Now, usually for you to get to this position, your CD4 count usually is below 200 copies per 1 milliliter. This tells you all below 200 cells per 1 milliliter. And usually, you may be having a viral load of above 1,000 copies per 1 milliliter, or you may be having, if you have initiated treatment, you may be having a good or an accommodative viral load, but very low CD4 count, which means your immunity is at stake. Now, this is the good thing. In any stage of HIV, that you are initiated on care, the prognosis is surely positive if you have good adherence. For example, in my practice, I have experienced managing a patient with CD4 count of 34 cells per 1 milliliter, and this person ended up raising the CD4 count to now currently 534 cells in 1 milliliter with undetectable viral load. This person, by the time of diagnosis, had cryptococcal meningitis and TB lymphadenopathy, but now they have recovered. Unfortunately, when you are diagnosed at this stage, you will have a drug burden. This is one of the biggest problems that most HIV positive patients suffer. Drug burden in such a way that you will be treated for cryptococcal meningitis if you have the cryptococcal meningitis. If you do not have it, you will be started on prophylaxis, fluconazole prophylaxis, to prevent you from getting cryptococcal meningitis. Now, this person, if like my client, had also TB, so remember taking cryptococcal treatment, taking anti-TB treatment, taking septrin prophylaxis, and also taking ARV. This is a tall order. And to avoid all this drug burden, you can be able to start your treatment very early and prevent yourself from getting all these opportunistic infections. Are we together up to this point? Thank you. Now, in my conclusion, this is my plea to anyone who is HIV positive. Please, if you know your HIV status and you know your HIV status is positive, please, it's very advisable. HIV is one of the most forgiving viruses that will not present its symptoms very early. You can stay with it up to 12 years. I've seen in my practice a child presenting at 16 years not knowing her HIV status, yet the child was born or was raised HIV positive due to ignorance or maybe omission of the mother to prevent this child from acquiring the virus. So it can't be too late. Let it not be too late for you to be started if you know your HIV status. If you have poor adherence or you are not taking your drugs properly, remember, if your CD4 count are going down, you are risking getting an opportunistic infection. Also, if you are not taking your drugs properly, you are risking drug resistance. And remember, if you get a drug resistant and you are using a first line HIV regimen, we will move you to a second line. Or we will monitor your adherence, and we may monitor your adherence until you get an opportunistic infection. So as we are pushing you to a good adherence so that we can be very assured that you will not be able to mess with the second line that we are planning to offer you. So guys, ladies and gentlemen, adherence is very key, and if it were not for good adherence, most people could not have made it to the far that they are. So ladies and gentlemen, adherence is key if you are HIV positive, and also if you have not yet started on treatment, or if you discontinued your treatment due to maybe false beliefs. Remember, you're not the first one, you're not the last one, and people have tried these things and they never worked. If they could have worked, I think we could have pushed everyone to those religious beliefs. But now, since it's a myth, please observe your adherence. Thank you.